One question we often get from new patients is, do you take x-rays? It's a fair point. I'm going to explain to you why we don't take a lot of x-rays, and I'm going to use this door as an analogy to explain why OMNE Chiropractic doesn't take a lot of x-rays. Dr. Peters here with OMNE Chiropractic, providing solutions to pain and performance, sports chiropractor here in Omaha, Nebraska. One of the questions we frequently get when patients initiate with the clinic is, do we take x-rays? I want to touch on that today. I want to share with you the two reasons why we don't take many x-rays and we don't have an x-ray unit in office. So the first reason we don't take a lot of x-rays is because clinical practice guidelines recommend against it. You're not supposed to image patients in the first 6 weeks of an acute lower back pain episode outside of clear clinical indicators, and those would be like a history of trauma, whether it's a motor vehicle accident, slip and fall, maybe you have a history of cancer, infection, or fracture in the area, or progressive neurological deficit. So all those scary stuff we catch in the history and decide whether we need to x-ray or image the patient prior to chiropractic care. But the vast majority of our patients, we actually don't do that, because after 6 weeks, most of our patients are better. They're off living their lives, they're golfing, they're playing with their kids, they're back to work, they're functioning at or near 100%, and they don't need an x-ray. The next part of this is that it adds a lot of unnecessary costs. Images cost money, it exposes patients to radiation, and it gives them a bunch of diagnoses and scary words that aren't clinically relevant, like degeneration and spondylolysis and all these different arthritis terms. So we don't like to x-ray patients because, one, we don't like to scare them and give them a bunch of stuff that's not really impactful on their condition. And we definitely don't do repeated imaging, which is what a lot of chiropractors have done in the past. And it just shows like a side-by-side, and it just adds more cost, it scares patients, and it's not clinically meaningful outcomes. We like to test our outcomes based off of functional outcome assessments, as well as we have the patient-specific functional score. So different ways to kind of track meaningful progress. Patients are super, super happy with our approach that doesn't require x-rays. So reason number two why we don't take a lot of x-rays is because we're focused on function and not structure. Think about it like this door. I use this door analogy a lot. We can take a picture of this door, but it doesn't tell us a lot about the door. You know what tells us about the door? Is if we open it and close it, we move it. Maybe we have a squeaky hinge. Maybe we spray it with a little WD-40 and see if that helps. So we get a lot more information from this door by moving it, opening, closing, jiggling a little hinge, maybe tightening a bolt. And that's what I like to think of with our chiropractic approach, is that we can assess function in the office and move you and see how you move and look at your movement patterns, and it tells us a lot more information, and we don't need the x-ray because we're focused on the function and the movement rather than the structure. Because a lot of the time we take a picture of somebody, we're not going to change that structure. Yeah, we might have a slight increase in curve post-care, but that's probably not important anyways. I'm more concerned is, how do you squat? How can you move? Can you lift your kids? Can you golf? What's your rotation in your thoracic spine like? So we like to focus on the door analogy. We get a lot more information by watching you move, by opening and closing this door, than we do from a snapshot in time, which is all an x-ray is. So if you have any questions, if we ever need to use imaging or x-rays, we have some awesome facilities in town. We work closely with our patients' medical doctors. We can always get an image. A lot of times if you have an image, then great, bring it in with you. We'll take a peek at it. But most of the time in our office, we do not need x-rays because patients get better without it.